When proteins are misfolded, it can impair our body's normal functioning, and problems may arise over time. Our bodies are usually pretty good at identifying and removing abnormal proteins. In some cases, though, we either produce too much of the abnormal proteins for our bodies to handle, or we're not able to break down and clean up the proteins at all. Amyloidosis is just one class in a growing list of protein-folding disorders. While there are many types of amyloidosis, in all cases the misfolded proteins called amyloid, meaning starch-like, take on a particular shape that makes them very difficult to break down. Because of this misfolding, amyloid proteins bind together to form rigid, linear fibrils that ultimately end up in our tissues and organs. Depending on where the amyloid accumulates, such as in the kidneys, heart, nerves, or gastrointestinal tract, different symptoms become apparent as those organs are affected. The symptoms of amyloidosis are usually vague and non-specific, such as weight loss, fatigue, shortness of breath, foamy urine, swelling of the ankles and legs, and numbness or tingling in the hands and feet. Because these symptoms mimic those of other common conditions, often being mistaken for heart, lung, or kidney disease, it's not uncommon to see several physicians before a biopsy is taken. But if there is kidney, heart, nerve, gastrointestinal, or liver disease with no obvious cause, it should absolutely prompt physicians to test for amyloidosis. The four most common clinical settings in which amyloidosis should be considered are 1. Loss of massive amounts of protein in the urine. 2. Stiff or thickened heart. Low voltage on electrocardiogram, irregular heartbeat with normal or low blood pressure, or unexplained heart failure. 3. Enlarged liver without alcohol consumption or other explanation, often with abnormal liver blood tests. And 4. Numbness or pain in the fingers or toes, such as carpal tunnel syndrome, or alternating bouts of constipation and diarrhea, while also feeling lightheaded when standing up.
Well, there are three main kinds of amyloid that actually can affect the heart. And there are over 20 proteins that can form amyloid, but only really 3 that affect the heart. So first we'll talk about those. The first type is called AL amyloid, and the A just stands for amyloid, and L stands for light chain type. And this is an immunoglobulin, a protein that is normally made to fight infection. But you have abnormal cells in your bone marrow that are making too much of these light chains, and they form amyloid protein that deposits in the organ and tissues of your body. Another main type of amyloid that can deposit in the heart is what's called transthyretin amyloid. And it's named because the protein that we all actually have in our body, it transports thyroid hormone and retinol, which is vitamin A. So the letters TTR are for transports, thyroid hormone, and retinol. So we abbreviate that as TTR.
To benefit from the many treatments now available. Depending on the type of amyloidosis, treatments may include chemotherapy, cardiac care, organ transplantation, or targeted drug therapy. In each case, the aim is to reduce or eliminate the supply of amyloid protein so that organ function can improve.